Run your day with Runday.ai.
Alan, hello. Happy Friday. How are you today?
Hi, Sanjay. Good morning. How are you?
Good. I'm in Fort Lauderdale today. Just drove down with the RV from Atlanta for Thanksgiving. Where are you calling from?
Great. I'm from our downtown LA office.
LA.
Beautiful city, Southern California.
I almost moved to Carlsbad years ago. I did some spiritual training there years ago, and I was considering moving there. And one day I jumped in the water in July, and it was freezing, and so I ended up in Florida instead. And I'm a free diver.
Yeah, no, this is not Florida waters here. It's very cold. People don't realize, but it's beautiful. Carlsbad has a great 5K I used to run.
Yeah, very cool. Well, tell me more about the business. What are you doing for your customers?
So we're a tech-enabled solutions firm, very much focused, first of all, healthcare. And for folks who are in healthcare, we're in the value-based care space. Health plans are all about value-based care. They are simply an engine, right, that runs risk. They're all about taking an amount of money and then providing really good care and quality for that money, right? So that is risk. But we also deal with providers who are downstream from plans who want to participate in that risk and really align with the plan to reduce costs and improve quality. So we provide TPA services to plans, meaning providing their core platform, CM, quality, analytics, EMR integration. And we do the same thing for downstream providers, some of which might be delegated in claims in a place like California, or nationally if they're an MSSP, ACO, ACO REACH, or IPs or CINs outside of California. Generally, we're providing more of the analytics, care management, network support, some of the non-claims pieces.
Very interesting. And then how did all this get started? What was your first customer or the first business opportunity?
We've taken a journey, Sanjay. We require more time at a bar than we have on the podcast, but suffice it to say that we were born as a bunch of folks trying to help people in the community in Venice, California, at Venice Family Clinic, actually. We evolved over time and really through a couple of different projects, one with the big general hospital here in LA that I'm now the chair of the foundation for. It's every fourth ambulance run actually goes there. It's the biggest trauma center here.
Cool. Wow.
We worked with them quite a bit on ER diversion and network alignment, public-private. And then we started doing some work in Texas, same type of thing. And bottom line is, as we worked with providers, we realized that A, they didn't have the data they needed to manage populations outside their EMR. B, they didn't understand the finances of
what kind of data was missing?
Anything outside their EMR. So, when you're a provider, right, and you've got Epic and you think you've got the whole world, of course, you only have whatever happens when the patient comes to see you. You might have some Epic connectivity, right, with other folks on Epic be able to see things there, but you're not seeing the universe of everywhere that patient goes, right? So when they go to pharmacy, lab, other types of places, you're often not getting that information. And even if you're getting a visit or an encounter, you're not getting the cost. And so it's very hard for providers who want to take risks to understand what costs are occurring and where and what's preventable outside of their own walls.
I think Gemini knows my health better than my doctor does because it reads all my email now. So I think the last blood work I did, I just kind of threw it into some AIs and I was, this was even 6 months ago. I was remarkably impressed by the lifestyle recommendations I was given.
Look, I mean, AI it's gone a long way, right? I think my rule about AI is that you need to understand the limitations. You're right while you benefit from some of the opportunities. You got to, when you get into the life and death situations we have in healthcare every day, like whether a plan plays a claim, whether you utilization management approve or disapprove something, you want a doctor checking, right, to make sure that the answers are correct.
That can't be hallucinated or possibly inaccurate, right?
That's right.
What are some other ways you guys are leveraging AI for growth?
So we leverage AI in a few different ways. We use Agent like everybody else does, right? From what I understand, we're not the only company that cut our teeth with Agent, using it for sales, for instance, right? Text and email outreach, recruitment of employees, that kind of thing. We also use AI as because we do professional services alongside our tech. So like any professional services firm, our team is learning how to build their decks and aggregate and synthesize knowledge. We're using it as a library for all of our knowledge over the past 20 years to organize. So, hey, we got to go do care management for this client. What have we done before? Pull together the best practices we found into this scope. So a lot of the kind of internal professional services organization, we're using it, of course, for and CM, the typical use cases you see across the industry right now to really just make the professionals' lives easier. Maybe it's a preset care management plan or some of the auth in pre-auth in helping that along. And then finally, I think outside of those things, we're looking at what are the opportunities in terms of our core system for the company? So HR, finance, IT, are there ways to make it less expensive leveraging AI? So we're actually doing an RFP right now to some of the big kind of core, I forget what they call those platforms that do all of your HR and IT and everything, and see if we can leverage AI there as well.
Oh, very interesting. And then if somebody, is interested and needs this, what's the best way to work with your team? Should they get in touch with you or just do contact on your website?
I'm always available for sales. Sales is my number one, number two, number three job as a founder and CEO. I do have a great team. We have info at Cope Health Solutions. I get those, but a number of people also get those and jump on them. And so anybody who's interested can either contact me directly at amiller@copehealthsolutions.com or contact us at info@copehealthsolutions.com. My cell phone also tends to be all over the internet, and I occasionally get a call, and that's great too.
Oh, wow. And then it looks like you have a 3-minute assessment that adds some value to see if this is a fit, right?
Absolutely. Particularly if you're a provider, it's more provider focused. If you're a
Got
provider
it.
thinking about taking risk, it helps you assess where you are on the spectrum.
Well, thank you so much for joining today.
Thank you for having me, Sanjay. Have a great day.